Every day in BC, people lose their lives to toxic drugs. In December 2024, deaths averaged nearly 5 per day. 8 years ago in 2016, the spike in numbers was so startling, the province declared the toxic drug crisis a public health emergency. Since then, over 16,000 people have died here in BC. That's nearly enough people to fill Rogers Arena. Now behind the numbers are real people, real loved ones missed by those they've left behind.
Jordan was 25 when he died, so he did not even get to taste adult life in a way. His absence hurt a lot of people. Life is never the same.
There's a lot of grief, a sea of grief that is around us right now.
It's so wrong that he died. He didn't need to die. He did not need to die. These deaths are so preventable.
How did we get here? How could a crisis balloon so overwhelmingly, and where did it all begin? How do we move forward? Here's everything you need to know about the toxic drug crisis.
In my mind, it is the biggest health crisis. We survived COVID with less deaths.
So the scale of the harm is really beyond anything that we can measure, and it transcends every part of society.
Definitely over the last decade, it's become just increasingly devastating.
In BC, we're looking at this as being the leading cause of death.
You could say 2016 in BC is nearly synonymous with the deadly drug crisis, the turning point for the public health emergency. But the tragedy did not begin there. The number of deaths growing incrementally but surely nearly a decade earlier. DJ Larkin is the executive director of the Canadian Drug Policy Coalition. They recall the moment they realized something was off.
We've had problems for a long time, but we really started to see a switch. 2012, by 2015, there was a lot of alarm. 2016, we declared a public health emergency.
A decade ago in 2015, the province saw a dramatic spike in toxic drug overdose deaths, 30% more than in 2014. That led the provincial health officer at the time, Dr. Perry Kendall, to declare a public health emergency, the first time a province has taken this kind of response to the drug crisis. So what does declaring a public health emergency do? Essentially, it unlocks some power for the province. For example, during the COVID-19 pandemic, Dr. Bonnie Henry declared a public health emergency, allowing things like safety measures and public health orders to be immediately enforceable. You could say it gives the BC government more power to take action. In the case of the toxic drug crisis, it allowed officials to gather more data about overdoses, like where they happen, what drugs were involved, whether or not it was fatal, and who is often impacted, how old they are, their gender, etc. These were meant to inform how the province acts and moves forward, to protect people and ultimately how to prevent more deaths from happening. Fast forward to the early 2020s. As you'll recall, the beginning of the decade, 2020 through 2021, was rough for the province and the world over, the COVID-19 pandemic claiming the lives of many. But the numbers didn't end there. From January 2020 to July 2021, about 1,800 people died from COVID-19. The number of toxic drug deaths during the same period, about 3,000.
And then the next point that we really saw a change was the pandemic. The nature of the drug supply changed. And it's more toxic, it's more volatile, it's less predictable, and it's never gone back to the way it was.
Sometime a year later in May 2022, the Canadian government granted British Columbia an exemption to the Controlled Drugs and Substances Act, making it legal in specific circumstances to carry a small amount of illicit drugs. Here is a legal expert outlining the legislation.
The British Columbia government went to the Federal Minister of Health, who has that exemption authority, and said, we would like to do this trial program of decriminalizing small amounts in the possession of individuals in certain places.
It was the first major piece of legislation that sought to address the toxic drug crisis. And this piece of policy became, for many, the central turning point in this crisis.
There is no one-size-fits-all solution to preventing or reducing overdose deaths, but this exemption is a start.
And it's not going to change the crises that we're dealing with overnight, but it is a philosophical and an important step.
The BC government said the goal was to reduce stigma around drug addiction and to remove fears of criminal persecution that keeps people from reaching out for help.
Decriminalisation, right? Removing criminal sanctions for people who use drugs, because we know that criminalisation drives stigma and discrimination. And obviously that creates a barrier for people to come forward and access health services and harm reduction services and access drug treatment.
One of the points of allowing for decriminalisation, I mean, of course, it deals with the stigma and shame and the difficulty of encounters with police, but it also is safer to have people around for help if you need it. That's the whole theory.
They said the goal came from a view of addiction as a health issue, not a criminal one. It's an approach that international advocates say works.
There's an increasing trend around the world of governments exploring decriminalisation measures. There are 59 jurisdictions around the world in 39 countries that have implemented some form of decriminalisation, in the acknowledgement that criminalisation is only creating greater harm, and driving people away from accessing services. So more and more governments, of those 59 jurisdictions, more than half of those have decriminalised in the last 10 years. So it's an increasing trend, in fact.
So going back to BC's drug decriminalization pilot, which began January 31st, 2023. Under the pilot, anyone age 18 and older in the province can legally carry up to 2.5 grams of some drugs for personal use. That includes cocaine, methamphetamine, MDMA, and opioids, including heroin, fentanyl, and morphine. The 3-year program lasts until 2026. The initiative was supported by the NDP government.
So we had a decriminalization pilot put forward by the NDP under David Eby, and it was really responding to the sense that a strong law and order approach incarcerating anyone with possession of even small amounts of narcotic was in many ways counterproductive, pushing people who needed help from the healthcare system into the judicial system instead.
And backed by advocates working on the front line of the crisis.
We pretend that we can make drugs disappear by making them illegal. That has never worked. We've had a legal system in place since 1907 that said if we prohibit drugs, they'll disappear. No one is surprised that has never worked. What it does do is create a system where you're not allowed to regulate who can access it, where, and how, and you're not allowed to regulate what's in it. It's like if we put in a system of law that said we want to decrease driving, so we will not allow airbags or seatbelts, and we won't test the brakes. It doesn't work.
Now, the approach to managing the toxic drug crisis has been a polarizing one from the start. Many government leaders, medical officials, health experts, and drug user advocates unable to agree on how to deal with it. It didn't get any better when decriminalization entered the picture. From the start, many have criticized the program, from everyday British Columbians to people running for office.
Refocus those that are struggling with addictions to get them treatment, not do what the current government is doing, which is just hand out drugs to people struggling with addiction. And those that have untreated mental health that we see on our streets all the time, we want to make sure we take them off of the streets and put them into 24/7 care.
No more free drug for all drugs near our schools or playgrounds or spilling out into residential communities.
For the BC Conservatives, it was a key campaign promise. Their, quote, tough stance, a vow to make BC safe again.
It has taken tools away from police to have a civil society, and it is obviously not working in terms of when you look at the numbers of people who are dying from overdoses. We will stop the drug legalization. This whole issue of safe supply is not safe, it is dangerous.
On the other side of the fence, advocates say while the program doesn't address everything about the crisis, it's a step in the right direction, ensuring people struggling with drug addiction aren't forced to go into hiding or discouraged from seeking help and treatment.
So it is the coming together of two really important spheres. On one hand, it's decades of advocacy by people who use drugs and community healthcare workers, harm reduction workers, saying this is a way for people to better connect with services, this is a way to decrease harm for people. And that came together with essentially a mountain of research and evidence that demonstrates that decriminalization can be a really effective policy to improve people's social, health, and economic outcomes, and that policing isn't working.
I feel that decriminalization, I feel that people that use substances or of any sort should not be criminalized for it. And I feel that the way that it was handled here in BC was erroneous and that it was set up for failure. People deserve a chance, and I do feel that the BC government blew it when it came to decriminalization, and I feel that they blew it at the hands of the police. They allowed the police to control the narrative on this.
Some say it's a way of dealing with the crisis as a public health issue, not a criminal justice one. They also highlight the need to distinguish between toxic drug use and issues of public safety, with some experts saying the effects of either of those are often conflated.
There was a move instead to recriminalize people in public spaces. And we are seeing how the data is bearing that out now.
It doesn't deal with the problem, it simply takes it out of the purview of the public. So then, of course, this move to recriminalize, as it were, the bulk of the exemption that was initially granted has been significantly criticized by experts and advocates.
The issue there is it can be quite dangerous for the people who are impacted, people who are at risk, but it doesn't solve the problem that other folks in communities want to solve either. It doesn't create housing, it doesn't create health services, and it doesn't actually make communities safer to seize someone's drugs and arrest them. It actually makes communities less safe.
It's now 2025. We're 2 years into BC's 3-year drug decriminalization pilot. Things haven't been so smooth sailing as we've heard. In 2024, just halfway into the program, Premier David Eby backtracked a little and requested a few changes from the federal government.
Illicit drugs and hard drugs should not be used where kids are playing, where patients are recovering, where community life is lived.
Specifically recriminalizing the use of illicit drugs in public spaces, the BC government citing the need to balance compassionate care with public safety.
People who are struggling with addictions are people that we love, but sometimes tough love is needed.
The pleas worked, and the federal government stepped in to recriminalize the use of drugs in some public spaces. The move was welcomed by some and opposed by others.
Especially with the kind of decrim initiative that was started in 2023. It's really a shame how that played out, because I think the public were completely misled about what that would achieve. Of course, decrim was going to reduce, interactions with police.
They chose not to enforce the laws that were in place. They allowed decriminalization to fail, and because they didn't want it to succeed.
It was not going to solve the problems of a toxic drug supply. It was not going to solve the problems of public drug use when there's a housing crisis. So I think, politicians and policymakers have misrepresented what decriminalization is and can achieve, and it is a necessary intervention. We advocate very strongly for decriminalization.
At no point do any of these policies address the root causes or origin of what's happening.
What we have to be really clear about is more prohibition, more draconian measures, more efforts to suppress both the drug supply and, deter people from using drugs through punishment and repression are simply not going to work. They're going to keep leading us down this very tragic road.
Today in BC, 7 people will lose their lives to the toxic drug crisis. 70% of those deaths will be individuals aged 30 to 59. Of those deaths, 85% will be the result of illicit fentanyl. Today, unregulated drug toxicity remains the leading cause of death among British Columbians aged 10 to 59.
So the scale of the harm is really beyond anything that we can measure.
So what is the solution? Well, the issue remains complex. Some say we need to close down safe consumption sites and focus instead on treatment centers. Others say the Safe Supply program has made things worse. while advocates say without them, more people will die.
I'm looking at it as more of a crisis of an unregulated drug supply, because if we had a regulated drug supply, people would know what they're taking, they would know how to dose with it, and we would save lives.
Advocates working on the front line say rapid and ongoing drug toxicity changes have made the drug supply more poisonous, and it's only getting worse.
The drug supply is constantly changing. It's changing week by week, batch by batch, supplier by supplier. So there is no continuity, there's no quality control, and that's the scary part of this. And it's not just changing with the opioids, it's changing with the cocaine, it's changing with methamphetamines, it's changing with the introduction of new novel drugs and synthetic drugs that are getting added into this. So it's so hard to stay on top of it. It's really difficult when you're getting, like you always find out after the fact is when people actually get their drugs tested. So this is already on the streets by the time people know what's in the supply.
If you pick something up today and you don't know what's in it, it doesn't matter who you are. The only thing that matters is, were you alone? Was someone there to call 911? Because it doesn't matter if you've used once a week, or every day. We don't know what's in the drugs and people are at risk.
We want to stop the deaths. I mean, that is the underlying premise of everything we do. And we know from research, from our studying, from our colleagues in research, we know that the way to stop the deaths is to implement a safer, regulated pharmaceutical supply of the substances that people need.
The toxic drug crisis claims more lives than car accidents and cancers, and the impacts of losing loved ones to this crisis are far-reaching.
So the scale of the harm is really beyond anything that we can measure, and it transcends every part of society. Children, adults. In BC, we're looking at this as being the leading cause of death.
I co-founded Mom Stop the Harm in 2016 with two other women who had also lost their sons to drug harms. My son died of a drug overdose, a prescription drug overdose actually, in 2014. He was a skateboarder, rock climber, snowboarder, and so on. And he was, exuberant and joyful. His absence hurt a lot of people, and still to this day, and certainly for myself and his dad, well, life is never the same.
Tracy Letts joined Mom Stop the Harm following the death of her beloved son, Michael. He was just 31 years old. Since then, Letts has been at the forefront fighting for change.
It's so wrong that he died. He didn't need to die. He did not need to die. These deaths are so preventable. How in your heart you can't reconcile that when you know that they're preventable and they shouldn't happen?
But of course, over the last 15 years and the last 10 years in particular, the number of drug-related deaths, overdose deaths, particularly in North America, has just been devastating. And it's been a really tragic trend.
There are hundreds of thousands of people right now in this country who are walking around holding grief every day because they lost a loved one and they didn't have to. And it doesn't matter if that person was wealthy, if they were a student, or if they were someone who was struggling and didn't have housing. There's thousands and thousands of mothers every day holding this crystal of grief that is sometimes so heavy that they need help or they feel like they're going to fall down.
Still, others say the root of the problem goes beyond toxic drugs themselves, and that both the cause of the toxic drug crisis and its consequences have to do with a network of interlocking challenges, like the lack of affordable housing and access to health care.
We're in this particular crisis because we didn't act swiftly enough in 2016. And because we're seeing a really deep intersection now with our failure around housing and healthcare.
What if there is no silver bullet? What if there is no one solution to the deadly crisis that has claimed tens of thousands of lives in the province of British Columbia alone?
There is no one solution to a wicked problem. There are a number of things we need to do. Decriminalization is essential because putting people in jail for drug possession does not work. It does increase harm. It increases homelessness, risk of overdose, income inequality, doesn't make our communities safer.
You know, every overdose is preventable. There doesn't need to be, overdose deaths, right? I mean, also we know that with safe consumption sites, there's never been a fatal overdose in a drug consumption room anywhere in the world, ever. That goes to show how that intervention saves lives.
Statistics don't tell us the full story. They don't talk about how a brilliant smile isn't here anymore. Yeah.
Advocating for policies that will actually stop the deaths or slow down the deaths is one way that we heal. And although the pain will never go away, it does lessen, and I am able to help others who find themselves in this situation that I have found myself in.
We need more access to health and treatment services. We need to actually control the drug supply, both the contents and the access to it. And we need to talk about education and actually be able to have real conversations. If we can talk about the birds and the bees with our children, we need to be able to talk about drugs as well. If we really focused in on those aspects, we would make an enormous amount of change.